Your behavioral health EHR MedPass workflow can take 10 to 15 clicks for a single patient, and your medtechs do it for every patient multiple times a day. Do you know how many clicks it takes to enter MedPasses in your EHR? Your medication techs do, and they feel every one. Medication management and MedPass workflows, where a clunky EHR quietly drives burnout, turnover, and medication errors. We will walk through the click problem, the burnout it causes, the safety risk it creates, and the workflow that fixes it. When a subpar EHR sucks the joy out of behavioral healthcare, MedPasses become an absolute nightmare for the staff who run them. In this staffing crisis, every turnover at your treatment center hurts your ability to provide adequate patient care. Behind every tech who leaves is a motivating irritant. Too often, the deciding one is a clunky, cumbersome EHR. Abject frustration is a recipe for burnout. Burnout translates to lost productivity and ultimately high turnover, a huge liability in this staffing climate. Don't be the organization with every asset it needs to function except the staff to actually provide care. Now picture the system glitching halfway through a pass and not being able to even reach a human on the support line. Behave Health's MedPass workflow is designed to eliminate repetitive clicks. Batch-processed MedPasses are designed to let clinicians step away from the computer and back to face-to-face care. Our batch-processed MedPasses are designed to minimize the clicks and screen time that wear staff down. Automated inventory updates are designed to remove another layer of manual, repetitive work from every pass. Here is the nightmare a subpar EHR makes your techs repeat. Picture the manual MedPass, step by step. Each of these steps might involve 1, 2, or 3 clicks, maybe a tricky drop-down menu to struggle with repeatedly. Step 1. Open the MedPass screen and navigate to the Med Admin section. Before a single medication is touched, the tech is already several clicks deep just to reach the right screen. Step 2. Enter or scan the patient, then check off their medication list. Identifying the patient and working down the medication list adds more taps to a process that repeats all day. Step 3. Scan the medication, then approve it. Scanning and approving each medication is where the click count really starts to stack up per patient. Step 4. Cross-check the medication, cross-check the cross-check, and finalize it. Now, do that entire process over and over for every patient in your facility, multiple times a day. Medication errors become more likely as staff burnout rises. When techs are clicking through repetitive screens, they're less likely to pay attention to what they're actually doing. The post is blunt. In extreme cases, these errors can become deadly. Efficiency protects patients, not just workflows. Improving MedPassing workflows means eliminating as many repetitive clicks as possible and giving staff back time at the bedside. The best behavioral health MedPass workflows minimize clicks and screen time so staff aren't chained to the software. Automated inventory updates remove a recurring manual task from the workflow entirely. The goal is to let clinicians do what they do best. Step away from the computer and focus on patients. Behave Health integrates Doctor First into the EHR, so clinicians can prescribe medications electronically, all within a single platform. Clinicians add medications quickly and easily, electronically, without leaving the platform. Doctor First sends orders directly to your preferred pharmacy, removing the logistical gap between writing and delivering a prescription. Behave Health's all-in-one app is designed to put clinical, administration, staff, admissions, billing, and insurance authorizations all at your fingertips. Batch-processed MedPasses and automated inventory updates are designed to minimize the clicks and screen time that drive burnout. Integrated Doctor First e-prescribing is designed to keep prescribing inside a single platform, straight to your preferred pharmacy. Behave Health can also help direct you to resources for licensing or accreditation by the Joint Commission or CARF. Stop letting clunky MedPasses burn out your staff. See batch-processed MedPasses and Doctor First e-prescribing at behavehealth.com. Get your free trial started to experience efficient MedPass and prescribing workflows at behavehealth.com.